Breaking news. Let's go to Albany and Governor Cuomo talking about the coronavirus and preparations for the state.
Commissioner Zucker was in Washington yesterday working with the CDC and getting a briefing on what the CDC had to say about handling the situation. The CDC made it clear that they'll be working with the states, and the states have a significant role in the coordination of the actual services that will be rendered. New York State right now has had 27 cases that we have explored. All of them have come back negative. There is one case that is still pending. There have been 53 cases of people nationwide who have tested positive for the coronavirus. I've said before that it is highly probable that you'll see a continuing spread of this virus. It's highly probable that we will have people in New York State who test positive. New York is the front door internationally. We have people traveling here from all across the world. You see how it's spreading and affecting different countries, Italy recently, but that will continue. And again, I think it's highly probable, and no one should be surprised when we have positive cases in New York. Our operating paradigm is always prepare for the worst and hope for the best. We've done that all across the board, and it's held us in good stead. We're coordinating all the relevant agencies from the state. Department of Health, Emergency Management, the Port Authority is here that runs the airports. And we're working with the hospitals all across the state, and Ken Rasky has been a great partner in that. We are also incorporating lessons we've learned. This is not the first time we've gone through a situation like this. Remember, we had the situation with Ebola at one time that caused great concern, and we went through that situation. We went through SARS. We went through the Zika virus, the H1N1 virus, Legionnaire's disease we had to deal with. So we've gone through a number of public health emergencies that we have dealt with, and each one seems new and unique. But we've handled situations like this in the past, and we're handling this one also. Some specific actions we're going to take. We'll be sending an emergency supplemental appropriations bill up next week to the legislature, asking for an additional $40 million as an emergency supplemental appropriation for the Department of Health. That, again, is to err on the side of caution. We want to make sure the Department of Health has all the equipment that they would need. Obviously, there's an international rush now to get the right equipment, the right masks, gowns, gloves, etc. Turns out that China is one of the main manufacturers of this equipment, which obviously makes it a little more complicated and problematic. So we want to make sure we're ahead of the curve on that. The legislation will also make sure that Department of Health has the authority to do what it needs to do to manage this situation. Within the next 2 weeks, the State Department of Health will be convening a meeting with all the local departments of health to communicate a standard protocol. All health departments should be doing the same thing. If there's a quarantine, what does quarantine mean? Home quarantine, how do we define that? Quarantine in a hotel setting, what does that mean? Sharing lessons learned, best practices. So the Department of Health will be doing that in the next 2 weeks. We're also going to be convening the private hospitals. The most logical situation to anticipate in this case is you may have a large number of people with flu-like symptoms who need healthcare attention, and that would be our hospital network and making sure that we coordinate the capacity, the available beds among hospitals if we do have a rise in the number of people who need hospitalization. And we'll be convening that group with Mr. Rasky's help. We're also bringing our airport operators. We have John F. Kennedy and LaGuardia Airport. JFK is the main airport, Newark Airport in this region that receives a large number of international flights, but people change flights. So we'll be bringing in all the airport operators so we make sure we understand, again, a standard common protocol among all those airport operators, and also that they're talking to the workers in their airports about what this is and what to expect and concerns that might come up. Again, people, every one of these situations, there's a certain anticipation, there's a certain number of questions, and people want their questions answered, and they should be. We'll also be asking the federal government to allow the state to do its own testing. This state has a very sophisticated Department of Health system and a very sophisticated laboratory at Wadsworth. One of the issues we now have is it takes a couple of days to get the testing results back. If we could accelerate that by doing testing in this state, and the CDC allowed that, that would be very helpful. As a matter of perspective, you take every one of these situations very seriously, and that's what government should do, whether it was SARS or Ebola or Zika or Legionnaires. We took everyone very seriously. If you prepare correctly, you'll have less of an issue when or if a situation develops into something that is more problematic. I was at the Jewish Community Center this past Sunday. There was a bomb threat, email bomb threat. And I remembered something I heard when I was in the federal government on emergency management. They said the threat you don't take seriously is the one that becomes serious. So we take every situation like this seriously, and we prepare for it. And but from a public point of view, I want to keep the perspective right. Yes, we're preparing, but this situation is not a situation that should cause undue fear among people. Yes, it is a serious illness, has a higher mortality rate than the flu, et cetera, but not like Ebola, not like some of these other situations. We had 17,000 people in the state of New York last week who had the flu, 17,000. So we've dealt with situations like this in the past, and we'll deal with it again. I'll stop there. Any questions for myself, colleagues?
I've had some concerns with the federal government lately. Do you have any issues or expectations of the amount of response to this that is less than robust?
No. Commissioner Zucker can fill in, but he was in Washington yesterday with the CDC, and they were quite clear about how their protocol going forward. Their point is they're going to leave much of this to the states. They give guidance to the states. The states then have to manage it. But I have no question about what the CDC is doing. I don't know that I have the expertise to question how the CDC is handling it. But Commissioner Zucker seemed confident about the briefing yesterday.
I was very confident about what they're working on, and they're addressing this, and they worked with. There were many states there, probably 20 or 30 states, maybe more, as well as local communities, and they were discussing how we could work together to address any steps that the states would need. And every state's a little bit different, and we recognize that.
Has the legislature already said they're going to approve the $40 million that you mentioned?
I spoke to the leaders about the supplemental appropriation that I'm going to send up, and they were supportive.
And you said that that bill or another bill will include measures to give the department authority to do what they need to do. What does that mean?
To the extent they may need additional authority to handle this situation, but it's an issue the Department of Health will be looking at. We just want to make sure that the state can do whatever it needs to do, purchasing equipment and supplies. If we have to identify additional staff in a relatively short period of time, coordination with our private health care institutions.
Maybe I already answered this, but I'm just curious, I mean, is it fair to say that this one is a much bigger threat than some of the others you mentioned, the SARS, for example? I mean, this has the potential to really be much, much worse?
Well, I think that each one of these threats are always a little bit different. We don't have all the data yet. This is an evolving process. SARS obviously had a much higher fatality rate, and so you can't put them both in the same category. This has been a little bit longer. SARS was a shorter period of time, so we'll have more information as time goes forward.
Yeah, but excuse me one second. You're right. I'm not a health expert. But let me just prompt your question a little bit, because I do consider myself an aspiring journalist. SARS, Ebola, were they more serious as an illness, where they had a higher mortality rate, et cetera?
So, yes, so Ebola had a 50% mortality rate. SARS had a 10% mortality rate. What we know right now is this is sitting at around a 2% mortality rate. Flu usually has about a 0.1 to 0.2% mortality rate. However, you also have to understand that there may be many more cases of coronavirus in China than were reported. So the potential is that the case fatality rate, I should say, would be lower. And MERS, which is another illness, has a much higher case fatality rate than this. So this is much lower.
That can mutate further, right?
Well, sure, viruses can always mutate, yes.
But they can always mutate, Zach. What we know today, MERS had a much higher fatality rate. Ebola had a much higher mortality rate. So how do you define serious? The mortality rate was much higher there. The commissioner's point is we're all relying on the China experience, and we're not 100% sure of those numbers. But just in terms of mortality rate for people who have had the illness, SARS, Ebola, MERS, all were much worse. And I'm not an aspiring journalist. I'm more like an aspiring editor. I'd like to be an editor as opposed to the initial journalism.
You mentioned PPE and what is on stock. I'm wondering, do hospitals have what they need? And to put a very specific question on it, how many N95 masks does the state estimate that it has, and how many do you estimate that you want or need right now?
Do you want to answer?
Please. Yes, thank you. That's a good question. The hospitals have been working on preparations now for weeks. I know that because our team has been working with each of them. And preparations have been going along relatively smoothly. The governor pointed out that the manufacture of much of these protective gear comes from China, and supplies into the United States will be diminished over a period of time. We do know that and expect that. The resources that we have are significant, though. The state, city, and federal government all have supplies of this type of equipment, which we could draw down through a need basis as we have our own supplies diminish. In addition to that, we have instructed the institutions to the best of their capability to conserve all of these supplies, because we do not know the duration of this epidemic. So from that standpoint, I think we're not sanguine, but we are comfortable that we have adequate protective gear, because after all, the number one thing that we must protect are our patients and our workers.
Do you want to elaborate on that in terms of the numbers?
We have in the millions. We have an enormous stockpile of masks and PPE equipment.
And you've been asking for the ability to test at Wadsworth for a while now. What's the holdup? When is that coming?
We have asked the FDA this has to be approved by the FDA, and we sent a letter to the FDA so that our lab, the Wadsworth lab, can run the test for coronavirus. We're waiting to hear from them.
The 83 cases have been found in Nassau County, or are being monitored, 83 people are being monitored in Nassau County?
We have a number of people who are being, what happens, and the reason it becomes relevant for who does the testing, you can be tested, it then takes a few days to get the testing results because CDC obviously is doing testing for the entire country. So you have that lag of time. We have one case that is still out and pending, and I believe that case is in Nassau.
Masks for a minute. Should the public be buying masks, or are they just contributing to a problem?
The masks should be for the healthcare workers. The public should not be buying masks.
And why is that? If you could just elaborate, because it's not doing any
Well,
good.
the mask should be used for someone who's symptomatic. There isn't an advantage for someone who's not symptomatic. And as we were saying, that the healthcare workers who are taking care of individuals who are of concern should be the ones who are using that.
Is there about the long-term ability to be able to address this issue when you said earlier this week hospitals are going to be losing out on $625 million in federal funding, and then local governments have raised concerns that your budget proposals could leave them short-funded to cover everything that they need to do. So is there going to be enough money to cover these costs if this goes on for months and months?
Yeah. First, this is not going to be a financial issue. If anything, and it depends how far out you want to extrapolate, if anything, it would be a capacity issue on number of beds if the projection was for a significant number of people to need health care attention at a hospital. But it would be a capacity issue, wouldn't be a finance issue. And I don't want to get into the whole Medicaid issue again, but suffice it to say, in every budget discussion that we have in the state, every interested party always says the same thing: I need more funding or the world is going to stop spinning on its axis. That is the universal response for every budget item in the state. And that's the argument everyone makes right now. On Medicaid funding, the issue is not the immediate financial effect. It is the rate of increase in the Medicaid program that took a sudden spike where it's now going up 7% per year. 7% per year is not sustainable. It was going up 3% per year. And all we're saying in the budget is we have to get it back to 3%, which is what it was when the local government was paying its share. Now that the local government isn't paying its share, but is administering the program, all of a sudden it jumped up to 7%. Why? Because they don't have a financial incentive to control costs, because the long-term care programs, frankly, went rampant, and it has gotten out of control. And it's not just a budget point of view. The taxpayer shouldn't pay that. They should not pay for waste and inefficiency, and that's what's happening now. So we just want Medicaid to be back down to the 3%, which was the normal rate of appreciation.
$40 million is going to be broken down.
Say that again, I'm
Can you
sorry?
explain how that $40 million appropriation you're seeking is going to be broken down?
It would be general Department of Health appropriation for their needs to deal with this situation, equipment, staff, whatever may develop. You know, these situations go in phases. This is the containment phase. What we're trying to do is, as people come into the country at the airports, find people who might have been exposed, do the testing. During the testing, quarantine. What does quarantine mean? Make sure everyone has the same protocol for quarantine. That phase is the phase that we're in now.
On quarantine, it was reported that 700 people traveling from China to New York were placed on self-quarantine. Is that the latest figure? And what exactly does that mean? What's the status of this case?
I have not heard. What does that number say that again?
They reported saying, I think
don't know.
There are people both in the city and outside the city that are quarantined. They're home. They're being monitored at home because they came from an area that has a high rate of infection. And so we've been doing that for a while. The individuals, as the governor has mentioned, there have been individuals that have been tested specifically, and 26 of the 27 have come back negative, and we're still waiting for the last person. I have to give you the exact numbers on that.
Susan. Wall Street implicates the budget. Is there any worry that this could have an effect on budget negotiations or revenues?
Well, a portion of the state's revenues, as you know, Susan, come from the financial industry. To the extent that Wall Street stock markets take a plunge, that is not good news, right? The increase in our revenues that we're counting this year basically came from financial bonuses. You know, we know what the numbers are for this year's budget. We're going to plan for this year's budget, and then next year will be next year. So I have no idea, you know, what Wall Street is going to be doing next year. If I did, I wouldn't be in this business, Susan. I would be in another business.
How is the state going to identify people coming into airports or any major transit hubs if they're possibly exposed to the coronavirus?
Port Authority does that. Port Authority runs the airports with the federal government, which is doing precisely that at the airports, right? The federal government is monitoring flights coming in. They're determining what flights are coming from areas that should be blocked or which are bringing people from areas where they should be tested. And they've done tens of thousands of tests at the airports. John, do you want to follow up on that?
Yes, sir. So the screening's ongoing. It began on January 17th. There's been approximately 19,000 people that have been screened. One thing to note is that the travel schedule from China has been significantly reduced. January 17th, there were 42 flights coming into JFK direct from China. Today, there are 8. So it's a significant reduction. There are also indirect flights of which individuals are identified by CBP through scrubbing of their travel data, and those folks are screened as well.
What about people from Italy or other areas now that we've seen this spread?
So the parameters of the screening is established by the federal government, and as of this morning, it remains what's been in place since January 17th is still in place today.
Would anyone like to see that expanded, perhaps?
I don't do screening.
No, but obviously we've got reported cases in northern Italy. There are cases in Iran. I'm sure we're getting flights in from Iran and Italy.
Yeah, the federal government makes those determinations, and I don't think we have any reason at this point to second guess how it's determined.
Governor, could you describe what would trigger, I assume, involuntary quarantines in the hotels or hospitals, whatever, and how likely that is?
I don't think it's likely at this point, but maybe Commissioner Zucker has a different idea.
I think that at this point, we continue to monitor those who are coming in from all areas, from China, and if anyone comes in with symptoms, we will appropriately monitor them, put them into a situation with quarantine if they're a person under interest.
But at homes?
At home for...
Trigger something like sending them to a hotel?
Well, I think that if somebody has symptoms, we'd send them to the hospital for evaluation. And if there's a way for someone to be able to be monitored at home, and if they're of concern and they're not exposing any other individuals, they stay there. So it really depends on a case-by-case situation at this point.
Some people haven't had, they don't, some people have, hold on a second, excuse me a second. Some people don't have homes here. Like we handled the situation with the cruise ship that came in, where they were passengers on a cruise ship. Some of them were not New York residents, so there was no home to go to. And I know some of those people were put in hotels.
When it comes to J-Code, state lawmakers are looking to completely wipe it out and have a new commission in that would be determined by public vote, and the argument there is that because they don't trust you to be able to sign a bill over. How do you feel about that?
I haven't heard it, so I'll see what they put forth.
Well, have you heard back from the president on the luncheon?
No, that's an ongoing conversation that we're having. Again, the situation there is we now have a state DMV database that has undocumented people in it, by definition of them being able to apply for a driver's license under the green light law. The state and I personally are committed that we will not allow that DMV database to be used for immigration purposes, what they call civil immigration purposes, period. And the federal government's position is they want access to that database for civil immigration purposes. Other states have also taken the position that they won't share the database. The federal government is suing those other states, California, et cetera. Our law was more emphatic, and they've taken additional action against New York, which is the Global Trusted Traveler Program. It's unrelated.
We've been listening to Governor Andrew Cuomo and health officials in Albany holding a press conference about the status and preparation in New York State for coronavirus. The governor having a cautious tone, saying they're taking it seriously and preparing for the worst, but hoping for the best. He said the situation should not cause undue fear among people. He also just started giving us a statistic-wise and some information saying that New York State has had 27 cases of coronavirus, all but one have come back negative. And that last one, the test results are still pending. He spoke about preparations between health departments, emergency agencies, airports, to all have the same protocols if, in fact, they are having to deal with cases, especially things like quarantine. We also heard from the Port Authority just on numbers of flights from China through JFK per day have been reduced from 42 flights a day to 8 flights a day. The governor's asking the state legislature for $40 million in appropriations money in case the state needs more money or anyone in the state needs money in a department to deal with the coronavirus. We'll have more continuing coverage on CBS and New York, as well as our website, cbsnewyork.com, and on TV at 5 and 6, CBS 2 News.